Good evening. Welcome to this press conference. First, I should explain that we are not wearing masks today because we have a sufficient safe distancing, and the journalists and reporters are not in this room. They are in their respective offices, and we have also sufficient safe distancing. And what is also important is that so that you can hear us better. So worldwide today, the number of COVID-19 cases have crossed the 1.5 million mark. And as of 12 p.m. today, we have confirmed an additional 287 cases in Singapore, the highest daily tally so far. More than 200 of these cases are related to foreign workers residing in dormitories. This is also partly due to our efforts to step up testing among this group. Director of Medical Services, Associate Professor Kenneth Mak, will provide more details in a short while. Overall, we expect the number of cases to continue to rise in the short term before it stabilizes, because it will take time for the circuit breaker measures to take effect. The circuit breaker measures kicked in about 2 days ago on 7th of April. While the crowd have thinned in town and central business districts, there are still some social gatherings taking place close to people's homes in our heartlands. Some are also not observing safe distancing when they have to go out for essential purposes such as to buy food. More than 10,000 advisories have been issued by our enforcement officers over the last 2 days. This cannot continue. The circuit breaker measures will only be effective if all of us abide by the rules and bear the collective responsibility of keeping one another safe. We will therefore step up enforcement, and we will not hesitate to take action against individuals or companies who flout the measures. Now I would like to ask my DMS, Professor Mak, to give an update on the details of the cases today.
Thank you very much, Minister. As of the 9th of April, 12 noon, we have seen 287 new cases confirmed and diagnosed to have COVID-19 infection. Of these 287 cases, 3 were imported cases, 219 were linked to clusters, 19 were linked to other cases, and 46 cases remained as yet unlinked. Epidemiological investigations and contact tracing continue, and we will continue to establish links as they become evident to us. Of the new cases that were linked to clusters, the majority of them, in fact, were cases linked to the dormitories. Many of these come from the S11 dormitory, and there's at least 160 cases from this particular dormitory. But the number does not reflect necessarily the number that were truly symptomatic. We've in fact started active case finding and are swab testing workers in the various blocks in the dormitory. And many of the cases that were test positive in this category were in fact workers who have very mild symptoms or were well. Our epidemiological investigations continue, and we have successfully linked several clusters together. And this is with the assistance of the Singapore Police Force as well as MINDEF. Preliminary links have been established between the cluster at the Mustafa department store, the Project Glory construction site, as well as 5 dormitories, and this includes the S11 dormitory, the Tampines dormitory, the Toh Guan dormitory at the Sungai Tengah Lodge, as well as Cochrane Lodge 2. Many of these cases started out, in fact, with a cluster at Mustafa, of which a number of these were employees at Mustafa. And when we believe that workers had visited Mustafa, and they subsequently transmitted infection to their co-workers, either at the Project Glory construction site or to other residents within the dormitories that they lived in. The transmissions most likely occurred through close contact, for example, at meal times, during breaks, but also between co-workers at work due to physical proximity at the work site, and subsequently to colleagues and friends within the dormitories as they engage in social activities. In total, we have 1,910 cases of confirmed and verified COVID-19 infection. of which 884 remain admitted in hospital, and 29 of these cases are in the ICU. We have had 314 cases discharged from acute care and 705 cases decanted to a community isolation facility or a step-down facility. 7 cases have passed on. Of the cases that were decanted into an isolation facility, the community isolation facility, 108 have completed isolation and returned home. Of those that were, in fact, were looked after within our private hospitals, there was an additional 38 that completed isolation. So in total, 146 cases have completed isolation and have in fact gone home. With regard to the dormitory, we've been working very closely with the Joint Task Force that's led by the Ministry of Manpower, the Singapore Police Force, Ministry of Defence, Singapore Armed Forces, and we provide the medical support for workers in the dormitories who are ill and fall sick. In the dormitories, which are of concern and which we have identified as isolation areas, we have set up medical posts, and the medical posts have medical personnel who looked after these workers as they present with symptoms. We've also, in addition to the medical posts, performed active case finding, going in to look for workers who are not well, and then, if necessary, to bring them down for further assessment. When we pick up symptomatic workers, we would make every attempt to isolate them and prevent them from then mixing with other workers within the dormitory. We will test them, and if they are tested positive for COVID-19 infection, we will continue to treat them in our hospitals or in our community isolation facility as it becomes available. Those who are not tested positive but remain symptomatic from the infections that they may have, we will keep them separate so as not to also have further any infections spreading to other workers in the dormitory. And as we extend our reach to reach out to all workers in all the dormitories in Singapore, we will continue to establish more medical posts in phases. Thank you.
Thank you. I'll now ask Minister Lawrence Wong to give an update on the efforts that we are putting in to manage the cases in the dormitories.
Thank you. Good evening, everyone. So let me just say a few words on the foreign worker dormitory issue. We've had foreign worker cases before, including cases in dormitories. But this time it's different because there are many more venues outside of the dormitories, as Director of Medical Services said, like Mustafa, like the Project Glory construction site, where the workers had either gathered together or worked together, and that's where the virus had spread amongst them. And then when they went back to their respective dorms, they transmitted it back to their fellow workers in these dormitories. Many had very mild symptoms, and so they continued to work. And that's why there was a delay in picking them up. And so it's very likely that the virus spread had been going around for some time in the dormitories, and we are now seeing all the indicators of it. So when you look at the situation in Singapore, I think it's important to realize and recognize that we are dealing with two separate infections. There's one happening in the foreign worker dormitories where the numbers are rising sharply, and there is another in the general population where the numbers are more stable for now. And that's why we need a different strategy, a dedicated strategy for our foreign worker dormitories, because there is a greater spread of the virus in these dormitories, and there is also higher transmission rates given the large numbers of workers living in close quarters. This is a very major and urgent issue that requires active intervention. And that's why at the task force level, we decided to put in more resources and to set up a dedicated task force focusing on the foreign worker dormitory. And we are enlisting resources from the whole of government, including help from the Singapore Armed Forces and the Singapore Police Force. As far as the ministerial task force is concerned, we are also tapping on other people to assist us. The task force at the ministerial level already has DPM Heng as our advisor. But for this particular work in dealing with the foreign worker dormitories, we have invited Senior Minister Teo Chee Hean to help advise and guide us for this piece of work. And given his experience, given that the SAF and the police force are involved in this work, his involvement has been very useful and helpful. What are we doing for foreign worker dormitories? There are two parts to our strategy. First, ensure effective management across all dormitories. And that's where the SAF, the police, are leaning forward, working with the Ministry of Manpower and the dorm operators to put in place proper management across all the dormitories given the current situation. That means taking care of the workers' daily needs and their well-being, because all of them now have to stay in the dorms. So you have to take care of very basic issues like cleanliness, hygiene, their food, delivery to each one of them. And at the same time, making sure that all the safe distancing measures we have put in place are fully complied with, which means ensuring that you minimize the movement of workers and minimize intermingling of workers. So that's the first key strategy, right? Effective management. We cannot rely solely on dorm operators anymore, given the current situation. The government is leaning forward, working with them, ensuring effective management. Second, ensuring effective public health measures are in place. And as Director of Medical Services said, this means deploying medical posts in the dorms, starting with the critical ones, but eventually scaling up to all the dorms, actively screening and testing workers, and then separating those that are infected and the suspect cases from those that are healthy. To do all this well, we will need to reduce the number of workers in each dorm so that the situation is more manageable. So we are moving out workers who are not sick, and we are, especially for those who are in essential services, because they still need to continue to work. So we are moving them out, those that are not sick and in essential services, and we are accommodating them in alternative venues. We have activated a few alternative sites, including SAF military camps, Changi Exhibition Center, that's the one where we organize aerospace, floating hotels. This is typically used for offshore lodge accommodation, so we are activating some floatels, as well as a few vacant HDB blocks. So these will be alternative sites where we can pull out workers that are not sick, that need to continue to work for essential services, and we can pull them out and accommodate them in these alternative venues. And in these alternative sites, we will also ensure sound management and public health measures, as what we are doing in all of the dorms. Essentially, we are sparing no effort to contain the spread of the virus in the foreign worker dormitories. We have a responsibility for these foreign workers who have come all the way here at considerable expense to make a living in Singapore. So we will do our part, and we will do our very best to take care of them and ensure their safety and their well-being. Despite our best efforts at containing the situation, all of us have to be mentally prepared that the numbers in the foreign worker dormitories will continue to rise in the coming days and perhaps even in the coming week or so. This will happen before they start to stabilize. Right? But we do have a comprehensive strategy, and measures are in place, and the agencies are now working round the clock to execute and implement them. And I will let Minister Josephine Teo elaborate on what are some of these specific measures. I've outlined the overall strategy, but she will give you more details. Thank you.
Thank you, everyone, and good evening. Minister Lawrence Wong has outlined two important key thrusts in managing the situation at the foreign workers' dormitories. One part of it has to do with how the dorm management has to change from the current model. The other part of it deals with how we can be effective in the medical management within the dorms. I will expand on what we are doing within the dormitories. The current model of operations has to go through major adjustments. For example, at the dormitories, it was always the practice for the workers to prepare their own meals. This has to come to a stop. In order to protect the workers, in order to reduce the opportunities for them to interact with one another, the human contact, which then raises the risk of transmission, we have to ensure that they are provided with meals instead. So this is one major adjustment that has to be made. The other major adjustment has to do with cleanliness and hygiene in the dormitories. Whereas previously, the workers left the dormitories for the better part of the day and were at their work sites. Now they are spending all their time in the dormitories. What that means is that in terms of the maintenance of the hygiene amenities, as well as the cleanliness management, it is of a completely different order of magnitude, and we have to be able to take care of that too. The other aspect that is also very important in the dorm management is that although all the dorms had dedicated sick bays, now we are talking about scaling them up in order to be able to appropriately take care of those that we need to isolate, whether they are still going through the period of assessment or afterwards. So those are the three major areas of changes in dorm management that we have to put in place. Now, whereas in the past it was always the dorm operators that took care of these things, I think we have to step in and help the dorm operators, because it is an enormous task to be able to implement these changes in a short time. Now, so that we can effectively enhance the dorm management, we want to be able to stabilize new procedures so that we can then replicate them and sustain these measures. So a stabilize, replicate, and sustain approach has to be adopted. How are we going to do so? We formed an interagency joint task force. This task force has already operationalized itself on Monday. And when this task force was operationalized, one of the immediate tasks that they went about trying to put in place was the formation of what is known as the Forward Assurance Support Teams, FAST, Forward Assurance Support Teams, FAST teams. What are these FAST teams? These FAST teams comprise of officers either from the SAF or the SPF, and supplemented by also MOM officers, each team being 9 persons, deployed to work with individual dorm operators. By Tuesday, we had 3 FAST teams already working with the dormitories that were gazetted as isolation areas. By Wednesday, we have been able to put together 43 FAST teams and match them with all the purpose-built dormitories that we have in Singapore. So all of these 43 FAST teams have been put in place, and they have been working round the clock. Now, what are the things that they have been trying to do in this stabilize, replicate, sustain model? The first thing that they have to settle will be the immediate task of making sure that food is delivered in a timely fashion and of a quality that brings sufficient care and comfort to the workers. That is very important, because the primary objective of these FAST teams is to ensure the well-being and the health and safety of these workers. So their first priority was to settle food distribution, needs to be timely, needs to be able to meet the quality that will bring comfort to these workers. We had initial glitches, but I think working round the clock over the last couple of days, this has mostly been resolved, and by now, most of the meals, in fact, can be delivered from the first person to get it to the last person to get it completed within 2 hours. Now, at the same time, the cleanliness and the hygiene have also been stepped up considerably. Whereas previously, the garbage, the rubbish were cleared perhaps once a day. Now it has gone to, on average, 3 times. And this depends on the size of the dormitory. At the same time, the cleaning of the toilets, the restrooms, as well as the disinfectation of the rooms themselves, the frequency has also gone up 3 times a day at the minimal. So if you look at the isolation, those that have been gazetted as isolation areas, the dormitories operations now, in terms of the food supply, in terms of the cleanliness and the hygiene, they have improved significantly, and I can say that they have been stabilized. And so when we gazetted the 3rd dormitory, To Guan, as an isolation area, all of the experiences that we gained in S11 and Westlight ensured that for To Guan, the implementation of these new measures were done in a much smoother fashion. So this part of it, having been stabilized, now our next set of priorities have to do with 2 main things. One is we will replicate what we have found to work in all the other dormitories that have yet to be designated or gazetted as isolation areas. In other words, the operations will also be brought to the same level, same standards as those that are gazetted as isolation areas. So you will see a consistency of approach across all the purpose-built dormitories. The other important priority now in the next phase is, as Minister Lawrence Wong says, we need to thin out the dormitories, reduce the number of people in each of these dormitories in order that within the dormitories we can have effective safe distancing measures. These safe distancing measures include making sure that all the workers who are still residing in these dormitories adhere strictly to the to the quarantine requirements, meaning that they stay in their rooms, they only leave their rooms to collect food or to go to the washrooms. So this is really important. We have to get it right. And we are progressively doing so for the 3 isolation area, the dormitories that are gazetted as isolation areas and all the other dormitories, progressively. Since Minister Lawrence Wong has already talked about where we are looking for alternative sites to enable some of the workers to move out, I will not belabor the point, but simply to say that it is part of the strategies that we put in place to try and ensure that the health and the well-being of the workers residing in the dorms continue to be maintained, and to the best of our ability, make sure that they keep healthy. We are, of course, also looking at other issues that the workers are themselves concerned with. For example, working with the employers to ensure that they are paid, working to ensure that they will still be able to provide for their families back home through the remittance services that they find very important. So I want to assure you that we are sparing no effort. The multi-agency joint task force is working very hard, and all the dormitories now have the fast teams that are deployed on the ground. We are progressively implementing all of these measures and will ensure that we continue to monitor the health and the well-being of our workers, and if they have any issues, to address them appropriately.
Thank you. Other than our efforts in managing the cases in the dormitories, we also need to continue to put forth our efforts in reducing the risk of transmission within our community. Over the last 2 days, we have received many queries from members of the public on whether they can continue to gather in groups, meet friends, have a meal with friends or with family members. Let me explain. The key message is really stay at home. Go out only for essential activities, such as to buy food or seek urgent medical attention. Not to go and socialize, not to have parties, not to meet each other, not to meet friends. This is very important. And we understand that some may have elderly parents who live alone, and they need to visit them regularly in order to help them with their daily needs. This we will permit, but do try to reduce the interaction times as far as possible and observe strict personal hygiene. This is in order to protect them. and do so, visit them only when necessary and not so frequently, because we do need to protect our seniors. And for the same reason, we will also not allow parents to drop off their children with their grandparents on a daily basis. Because every time when you bring your children to your parents or to their grandparents, we expose them again and again to potential infection. So if there's care arrangement for the grandparents to look after your children, then you should leave the children with your grandparents throughout the entire circuit breaker period. This is to protect the seniors, to minimize the risk of exposure to virus attacks. I understand that some essential workers may have problems with this arrangement because both father and mother have to go out to work and the children have to leave it with their grandparents. If you are able to leave them with childcare services, do so. We have made childcare services available for essential service workers. And if not, there are no alternatives, appeal to us and we will consider on a case-by-case, but only for essential services workers and only when there are no alternatives. This is to ensure minimum exposure for our seniors to this COVID-19 virus. The elderly and are vulnerable and most susceptible to severe COVID-19 infection. We should refrain from exposing them to the risk of infection as far as possible by avoiding frequent contacts. Every time we visit them, we put them at risk. I know these measures are very painful, but they are necessary to protect our seniors. And we'll continue to monitor the situation, and from time to time, we may need to tighten the measures further. And we also need to step up our enforcement to ensure compliance with these social safe distancing measures. Now, I ask Minister Lawrence Wong to talk about a little bit more about social distancing and safe distancing.
Thank you. So, moving on to what we have to do for, remember I said we are dealing with two infections. We've dealt with the foreign worker dormitories, but within the rest of our population, outside of the dormitories, we have the circuit breaker in place. I think if you go out along the streets now, or if you are outside, you can see that there is clearly a visible difference. Many people have complied with the instructions. They are staying at home and going out only for essential activities, and when they go out, many are wearing a mask. We are going to enforce the rules very strictly because there are still, unfortunately, people who are not following the instructions, and there are still some hotspots in Singapore. We know where they are when we are focusing on these hotspots and enforcing the rules very tightly. So we have more than 2,500 enforcement officers now out and about. First offense, they will give you a written warning. Second offense, there will be a composition fine. Third offense, you'll be prosecuted and there may be a jail sentence. So the enforcement agencies are going all out to enforce these rules very strictly, and we hope that Singaporeans will comply not just because of the enforcement efforts that are ongoing, but really out of a real necessity for all of us to do our part and ensure that this circuit breaker truly has an impact in controlling the spread of the virus. Even as we do all this, we are continuing to review the circuit breaker measures that we had put in place, because there are some places which we had allowed originally under the circuit breaker rules, but we are still seeing people gathering in these places. So for example, we had kept stadiums open because we thought this would be an avenue where people going out to exercise could, exercise in these stadiums without bunching together. But yet, unfortunately, we do see groups, people coming in groups to exercise in the stadium, which is not what the intention was, right? So we have decided from henceforth to close stadiums altogether. Because if there is no compliance and if these venues continue to be used for congregation of groups, then we cannot allow that to continue. So we are going to close stadiums altogether. The basic point is this: we are not stopping people from going out to exercise. But if you want to exercise, do it by yourself or do it with a family member that's already living with you, and do it in your own neighborhood. Do not go out to a special place outside, drive, make a special trip just to exercise. Minimize movement, minimize travel. Do what you need to do within your own local neighborhood. Do not exercise in groups, do not jog in groups, do not cycle in groups. Any of that would be any such activities would be an offense. So let's be quite clear once again about what this circuit breaker means. It really requires all of us to minimize movement and stay at home as much as possible so that we do not become the weakest link that causes another large cluster to emerge. Right? We are already having to deal with a foreign worker dormitory clusters. Let's not have more clusters emerge outside of that in our own community as well. And to do that, all of us really needs to do our part. So we are continuing to enforce and review the rules, and over the coming days, as we monitor movement, we may very well have to tighten up some more so that the circuit breaker will truly be effective and all the efforts and sacrifices that Singaporeans are making over this coming month will eventually pay off.
Before I open the floor to questions, let me just say a few words in Mandarin. 我们特别关心的是我们当中的年长者，我们的老人家是最可能被病毒感染的人，他们被感染后常常都会有较严重的病情，所以我们必须特别照顾保护他们。我们了解到有些人的父母亲年纪大，可能自己一个人在家里没有办法照料自己，没有办法料理他日常的需要。在这种情况下，你可以去探访你的父母亲，照顾他们，但是也应该尽量减少和父母亲交流的时间，也只有在必要的时候才去探访他们。在探访他们的时候，更要多注意个人的卫生健康，这样的话才能够保护我们自己的父母亲，保护我们家里的老年人。有许多的老人家也告诉我说，他们很想念孙儿。我们都很明白，这个是不容易的措施，但是这些措施是必要的，因为目的是要保护我们的老人家。如果我们想把孩子交给他们的祖父母来照顾，那就必须把孩子留在祖父母的家里，直到这个阻断期过后。这是为了要保护祖父母，因为每一次当我们把孩子送到祖父母那里的时候，就是多一次的让祖父母碰上被感染的风险，所以我们必须尽量减少这些风险。这些措施是必须要的。我们也了解到有一些必要服务的员工，他们因为需要工作，可能父母两个人都需要工作，孩子没有人照料，那么可以考虑把孩子送到托儿所那里去，特别为你们照顾这些孩子。如果有困难不能够送到托儿所，而必须要送到父母的家里，可以提出申请，我们会个案的来考虑，但是我们只限于那一些没有其他途径的，而且是从事必要服务的员工，我们会另外考虑。但是其他的人，我们鼓励大家尽量把孩子留在家里，或者是留在祖父母的身边，那么不要每一天的去把他们接送，就可以减少我们的父母亲所面对的被感染的风险，因为这是非常重要的，最重要的就是要保护我们的年长者。Next few days is going to be a long weekend. I appeal to everyone during this long weekend to stay at home. If you want to connect with your friends, your relatives, call them or have a virtual meetup with them over the internet or video calls. Each of us must take this circuit breaker measures seriously, because this is the only effective way for us to slow the transmission of the virus so that we can gradually stabilize the situation and reduce the number of cases daily. The health of all depends on each of us. If every one of us play our part, we will collectively be able to overcome this infection. Thank you. Now I'll open the floor to questions.
Before we start with questions, I would just like to correct the statement I made just now. In fact, we've seen 6 cases passing on and not 7. Thank you.
Right. Thank you, Ministers. We will now begin with the Q&A segment. Media agencies, please remember to use the raise hand function on Zoom if you would like to ask a question. All right, may we have the first question from Ke Yang from Cao Pao.
Hi, I have 2 questions. The first question is regarding the movement of the foreign workers out from the dorms. What is the scale of operation we are looking at in terms of numbers? And also, what will you mentioned about thinning out them from in the room? So, what is the ideal number per room for these workers? And we also understand that previously there were some foreign domestic workers that are under quarantine or stay-home notices in the dorms. Will they also be moved out? Second question is regarding the links between the cases. We understand that quite a number of them actually were linked to Mustafa. And then previously for the first foreign worker cluster, which is the Seletar work site, there were also some rumors saying that one of the workers had actually been to Mustafa. So what are the chances that these cases actually could have their origin started maybe like a month or more ago?
I'll ask DMS to talk about the linkages of the cases, and maybe Minister Josephine Teo can talk about the dormitory operations.
With regard to the links, the question on links, yes, we have found epidemiological links between the Mustafa, the cluster that actually occurred there, and more recently the outbreak of cases that's been occurring in the dormitories. We have, in fact, also looked to see whether or not there have been other links between the Mustafa cluster and elsewhere, but we have not actually established those links. The investigations include looking at the cases, whether or not there were possibilities that, in fact, people had visited Mustafa on the same day when others were there, looking at the onset of symptoms to tie down whether or not it's plausible, it's logical that, in fact, spread might have occurred from one particular person to another within that incubation period, within the time when we believe that person was infectious. And these were some of the techniques we used to establish the links within the current set of clusters that we're talking about. But with respect to the earlier cluster, which involved workers that you allude to from the Seletar Aerospace site, in fact, we were not able to establish that same link. The timings didn't match up, and certainly the cluster of cases that we saw in Mustafa occurred much later temporally compared to those other cases. So as of now, we have not established any formal link between that earlier work site-related cluster and with the Mustafa cluster, but for the later ones in relation to dormitories, we believe that this is a strong epidemiological link.
Thank you.
So Ke Yang had a question on the scale of the operations, and there are several ways to look at it. First, let me describe, what the size of the fast teams that we have deployed. Because every team is comprising of about 9 officers, then across all 43 dormitories, if you add them all up, we're talking about between 380 to 400 officers, thereabouts. Now then, another way of looking at the scale is in terms of the meals that have to be organized and supplied. In S11 dormitory alone, we're talking about 40,000 meals every single day. And so by now, just the dormitories in the isolation areas that had been earlier gazetted alone, just in the 2 or 3 gazetted isolation areas, we're talking about delivery of more than 300,000 meals already. So with more dorms being gazetted, or when we replicate the delivery of meals to the other dormitories, even if they are not gazetted as isolation areas, then you will see how big the scale of just a single operation of meal delivery. Then, of course, there is the cleaning operations, how to organize the manpower and also to make sure that they have the supplies, and also the scheduling of all the cleaning, making sure that they are done in a timely manner. Can I also give you another sense of scale through another dimension? This is of the workers that we are attempting to move out of these dormitories. Remember that in total we are talking about 200,000 workers in the 43 dormitories. Already those that perform essential services have mostly moved out. We're talking about more than 5,000 who have moved out. And then to the new facilities that they have moved to, in a similar fashion that we have implemented all of these management measures, these alternative sites must also have a proper management structure, regulating the to's and fro's of the individuals, making sure that also they are kept in good health, and if there are cases that give us cause for concern, that they are appropriately attended to from a medical standpoint. So the moving out of the workers will not stop at the 5,000 that I have already talked about. The intention is, of course, to move more out. As Minister Lawrence Wong had said earlier, we would like to be able to thin out more. And to the extent that we can do so, find the appropriate locations, ramp them up in time, then we will be able to accomplish this move, in a more timely fashion.
Thank you. Maybe next question.
Thank you. May we have the next question from Yuan Sin from Straits Times. Please speak after you have been unmuted.
Hi, can you hear me?
Yes, go ahead.
Yeah. Hi. So can I check when will all these sites, alternative sites, be ready, including the floating hotels, and how many floating hotels and military sites do we expect to see? And how fast will the workers be moved out? And on average, in each alternative site, what is the number of workers that we expect to see compared to the current number? And one more question on safe distancing and the wearing of masks. So will the wearing of face masks be made compulsory? And also when it comes to safe distancing, right? So will it be illegal to exercise at a park not within your neighborhood?
So if you talk about the alternative venues, they come in different different locations, and they will have different capacities. Military camp, for example, can easily accommodate thousands. Again, it varies. But the key for all of these alternative venues is not just a place to stay, but you need toilets and you need showering facilities, right? So all of these are essentials to ensure the well-being of the workers. So SAF camps have already been activated. Thousands have already moved. Minister Josephine Teo mentioned 5,000, more than 5,000 workers have already moved out. So some in SAF camps. We have a few also in vacated HDB blocks, just a few areas. One in Tanjong Pagar, another one in Jurong. So we have already identified them, and again, workers are already staying there. The total capacity is also in the thousands. A flotel solution is something that is being activated. The first one might be ready in a matter of a few days. That one flotel alone can take maybe 500 workers. These are typically done for offshore and marine workers. They provide accommodation for those who are doing offshore work. So the solutions are there, and again, we are bringing them in, and the first one will be activated soon, and then a few more will be activated as well. Right? Then if we go further out, we are also looking at Changi Exhibition Center, the one for the aerospace. That's a large venue. Again, it can easily accommodate thousands, and we are starting to prepare these venues. So it's more than, when we talk about these venues, there's a lot of preparation work involved to get them ready. And importantly, it's not just the venue alone, it's the management that comes along with the venue. No point putting workers there and then there's no management structure, right? So there is a need to do both in parallel. Workers are moved out, alternative venue in place, and then a proper management structure to ensure that the workers' daily needs are attended to ensure their well-being, and also to take all the necessary precautions in all of these venues as well. Meaning to say, if there is, for example, somebody who, should a worker fall sick even in one of these alternative venues, then we want to be able to quickly isolate them and not end up with more clusters in these venues either. Right? So all of these precautions are put in place as part of our foreign worker strategy. Your other question on the circuit breaker, you asked whether masks will be made compulsory. We are, as we had highlighted earlier, we had updated our guidance on masks based on evidence, based on scientific information. And that's why we now advise people, if you're going out, if you cannot avoid close contact, to wear a mask. We will want to make it mandatory in certain circumstances, and so we are already requiring food handlers to wear masks. It's you may not see it now, but that requirement has been put in place, and we are giving some time for the food handlers to adjust, but very soon all of them will be required to wear masks. We are looking at requiring this for food delivery as well. And then again, we are looking at other instances, other circumstances where we may want to make it mandatory. But so again, we are guided by evidence and scientific advice on our overall mask policy. Second, will it be illegal now to, say, drive to a park or a public area far away from where you are staying? Again, I said earlier, our advice is, if you go out to exercise, do it within your own neighborhood. We have not prohibited somebody from driving out or going further away, but we will review and we may well have to tighten. Some countries do that. If you look at the impositions or the people movement control and restrictions that some other countries have put in place, they are very specific, and they only allow exercise in your own local neighborhood. And if you want to drive out, and if you were to do so, then that specific activity is prohibited. So we are reviewing our guidelines, and we may well have to tighten if a lot of people are still doing it, because at the end of the day, as we said, the key to success of this circuit breaker is if everyone minimizes movement and stays at home as much as possible.
So I think, let me take this opportunity to share that many people have asked, can I do this, can I do that? I think it's important for us to bear in mind that the key message is really stay at home, minimize contacts, physical contacts, close contacts with people. And if you can't avoid that, wear a mask. And if you really need to exercise, which is important to continue to exercise and have sunlight, minimize the need to travel long distances, because the longer you travel, the risk of close contact with people will increase. So instead of asking whether I can go to a park far away, we should ask whether do we need to do that. If you don't need to go to a park far away, we can exercise near where we stay. Please do so. Minimize close contacts with people, stay at home as much as possible, and exercise as you need to do so. The next question.
Thank you, Ministers. Can we have the next question from Philip from Bloomberg?
Hi there. You mentioned that there might be, just generally speaking, a need to tighten up the rules even further. And so, what might be the next level of restrictions for the general public that we could expect if we don't see an improvement? Also, it'd be great to get more clarity on how you're moving out the workers from the dormitory in terms of not just 5,000. Are we seeing more than that? When exactly might we see that happening? And how many, in what increments? Thank you.
On additional measures, we've highlighted some, again, it's under review, but there are obviously a few areas that we can move on. Closure of small premises is one, right? Because we have allowed a certain category of premises to stay open. So we could consider looking at closing of more premises. And then number two, people movement that we need to address. If there is still a lot of people movement, a lot of contact, then we may have to tighten that. And number three, we've highlighted some hotspots that we really need to manage, one of which are our wet markets. We've kept these wet markets open, but we do know that many Singaporeans are used to going to wet markets on weekends, particularly in the morning. So now we are controlling the entry, exit, the access control. There will be queues building up. But again, if it's not sustainable, we may have to take more drastic measures there as well, right? For wet markets, actually, if Singaporeans start to change their habits, you don't all have to go on the weekend morning, on a Saturday or Sunday morning. Start to spread yourselves out. Go on a weekday where it's less crowded. Then maybe we don't need, additional measures. But if this doesn't happen, then we may well have to impose tighter restrictions. So these are a range of things that we are studying, reviewing, and we will want to do them quite soon, because if we delay further, it means, as I said, this circuit breaker period will just have to be extended longer, right? So we'll rather make use of the fact that we are now in a circuit breaker and do what we need to do quickly and urgently. On the movement of workers, you asked for more. Actually, the 5,000 workers, many of them, there are already 5,000, right, who have moved, right, and to these different venues. All right, so the more may happen, but as they happen, if there are more updates, we'll let you have the updates later, but the specific venues that I've highlighted are already occupied by workers at present.
Thank you, Minister. We will have the next question from Kwok Wai from Channel 8.
Question is about the facility at Expo. Could we have some update about that? Because it seems that things are up, and how many patients are you looking at housing that place? And the second question is, because we understand it's from Hall 3 to Hall 6, what about the rest of the hall? Will they also be converted? Yeah, that's all.
Thank you. These are the Singapore Expo is what we call a community care facilities, and I visited the facility this afternoon, just this afternoon before the press conference. The facilities are getting ready, and they're almost ready for operation. And very soon, we will begin, over the next couple of days, we will begin to send patients to the community care facilities. And these facilities will have two types of patients. The first type are the recovering patients who have been to hospital and they have more or less recovered from the infection, but they may still have virus in them, so we need to keep them and watch them and monitor them. And these patients will be sent to these community care facilities. One of them was at the resort, which I mentioned earlier, and some will be sent to the Singapore Expo. And the second group of patients are what we call the early patients. And these patients are confirmed cases, just confirmed. And many of them are actually quite well. They do not require extensive medical treatment. Most of them will recover over a period of time, and we just need to monitor them, make sure that they are well, and then take care of them. And some of these early patients will also be sent directly to these community care facilities without having to go to the hospital first and then sent back to the community care facilities. So these two groups of patients, we will be beginning to send them to these community care facilities at the Singapore Expo, beginning over the next couple of days. And the initial capacity that we are looking at, one of the hall will cater to about 480 patients, and we will progressively expand as the case as the demand goes up, as the number of patients increase. We will continue to expand the capacity as we go along.
Thank you, Minister. We will be taking the next question from Adila from Berita Harian.
Hi, good evening, ministers. Can you hear me?
Yes, they can hear
Go
you.
ahead. Go
Adila.
ahead.
Okay. Minister Wong, earlier you mentioned there are now two groups of infections, the one in the general public as well as the foreign workers. My first question would be, what are some of the indicators that infections in the general public has stabilized? And secondly, how would you assess the risk of cross-infections between the two groups happening? Thank you.
Maybe I'll ask my DMS to elaborate on the indicators of a stabilizing transmission.
Yes, we look at various things when we assess this. First of all, we actually look at numbers. We look at the number of new cases that are present. We look at whether or not they're linked to various clusters or not. We look in particular at those that are unlinked cases, but we have to bear in mind that it takes a while sometimes for investigations to complete, for contact tracing to complete, and when that occurs, unlinked cases may become linked cases, but we do want to make sure that we have an understanding of how infection spreads, and therefore those investigations continue. We look also to see whether or not there's subsequent generation spread. So for example, if we are effective in ring fencing, all close contacts arising from a particular person who gets infected, then we ask ourselves, when new cases occur, is it within the cordon we've drawn around, or are there other people outside that cordon? That gives us a sense whether we've successfully ring-fenced and contained this. And then we look to see whether new cases arise further. At this point in time, for those cases that are occurring outside the dorm setting, we've in fact found that, the new cases occur that are linked to individual other cases or clusters. They've so far been within this cordon that we've set up. They're mainly occurring in close contacts we've already identified and managed to quarantine, and therefore we remain confident in this particular setting that we have an effective strategy to further prevent spread occurring in the community. And of course, this would be further enhanced by the safe distancing measures that we've already put in place. You asked also about cross-infection between the two groups. We're particularly mindful of the possibility that if there's a lot of mixing between people, at close contact, then infection can occur. And that's partly the reason why we've also, when finding the new clusters that occur within the dormitories, gazetted some of them of concern as isolation areas where we control very strictly access in and out of these dormitories, then to prevent further circulation and spread that takes place into the community. For those who are continuing to be able to allow to work, particularly the workers who are involved in essential services, we do keep an eye on their health. They are instructed to monitor their temperature, to look after themselves, to make sure they don't have any symptoms. And where they are unwell, we quickly move them out, put them separate from everyone else, and we would then investigate to make sure that they do not have any COVID-19 infection as well. And we hope, therefore, with these measures, that the risk of spread further from the dormitories into the wider community is properly controlled.
Maybe I just add one quick point that we are mindful, as DMS had said, that we have to be able to isolate and contain the issues in the foreign worker dormitory within the foreign worker dormitories. That's why we already have gazetted, identified a few foreign worker dormitories as isolation areas, but for the other foreign worker dormitories, even without the designation, we are also controlling very carefully and tightly access of the control of movement in and out of these dormitories. Right? So with all the measures I've just described, we've highlighted, we want to contain the infection that's happening in the foreign worker dormitories, manage it, and then contain the spread of the virus within the dormitories. For the rest of the population outside of the dormitories, there will be foreign workers in our midst. Right? They are doing all sorts of activities, cleaning. I don't think we shouldn't then have an attitude that, as I said before, it's not because of a foreign worker being inherently of higher risk. The risk of infection for the rest of us in the population is the same, regardless of nationality, regardless of race. So all of us then, therefore, whether it's local, foreigner, all of us outside of the dormitory have to strictly comply with all the circuit breaker measures that we have been talking about. If you have essential work, go for your work, but within the work setting, take all the necessary precautions, and then after that, come straight home and stay at home, right? So that risk is not a foreigner or a foreign worker issue. That risk of infection or infection clusters breaking out in the rest of the population applies to anyone, any individual, right? Which can become a weak link. One lapse can result in a cluster forming. So all of us have to do our part to stabilize the situation and keep it under control.
Can I just add a point to what Minister Lawrence Wong has said? Now, although there had been a number of cases where the foreign workers who were tested positive for COVID-19, they lived in dormitories. But in fact, there had been no cluster of cases in dormitories until very recently. That's something that's very useful to keep in mind. And the earlier case to do with the 5 workers of Seletar Aerospace Heights, the transmission had occurred really at the work site, and it wasn't through the dorm, and it did not go beyond this cluster of 5 to other residents in the dorms. So all those in the cluster of 5 to do with the Seletar Aerospace cluster were separately quarantined, and then for 5 weeks thereafter, we did not have a single cluster in dormitories. So that's something we have to keep in mind. For 5 weeks, there were none. And so earlier on, Professor Kenneth Mark had explained how the hypothesis of the transmission is that it probably started somewhere in the Mustafa shopping center, and then because these workers were sharing the same work site, but they lived in different dormitories, and that's how the transmission then were brought into the dormitories. I think it is really important for us to keep this in mind. And also bear in mind that the dormitories are homes to the foreign workers, just as we go home every day after work. So within the dorms, the workers interact with each other very regularly, very closely. They're like family. And so the risk of transmission in the dorms was always there. But in fact, these dorm clusters appeared much later than even the cluster in the nursing home, if you recall. So what we now want to do is to prevent these clusters from further growing. And actually, the prevention, if we wanted to have done it earlier, it would have had to involve the closure of work sites and places like shopping malls. So that's something that we have to keep in mind. Now, the priority now must be to take care of the workers in the dorm, make sure that we keep as many as possible healthy. And that's why the comprehensive strategy that was outlined, both in terms of the dorm management as well as the medical management, should be the area of focus now.
Thank you, panelists. Can we have the next question from Niveda from NHK?
Hi. The ministers mentioned about hotspot. Sorry, can you hear me? Yeah. You mentioned about hotspots in Singapore. Can I, like for example, wet markets? Can I ask like what are the other hotspots in Singapore which we should be careful about? And number 2, can I ask about where the enforcement officers, where will they be going to check on people? Yeah, just those 2.
Everywhere.
Thank you.
I hesitate to tell you where the enforcement officers are going to because I think then people might congregate in the places where there are no enforcement officers. But essentially, the enforcement officers will be fanning out everywhere, all over, focusing on, as I said, some of the hot spots in our wet markets. Particularly on weekends, we see some crowding. In some of our parks, because people want to go out, and I can understand, we see some crowding. Earlier, I talked about stadiums where there are still groups coming together, and so we have closed stadiums. But for parks, I can't close a park. But what we can do is, and we will do, is control access where it's feasible. So in some of the parks, we will be very strictly controlling access. If the numbers build up, then we will stop people from entering the park altogether. In wet markets, we are doing the same for now. We are controlling access. So if the numbers are too large, then people will have to start queuing up to enter the wet market. So we'll be doing that this weekend, but as I said, we'll monitor, and if need be, we may well have to put in more stringent measures.
Thank you, Minister. We have the next question from Li Ying from CNA.
Hello. Hi, this is Li Ying. Can you hear me?
Yes,
Okay.
go ahead.
Okay, sure. So I just wanted to find out, so the workers will be thinned out and be moved out. How exactly are the workers prioritized since the essential workers are now mostly moved out? So those who are unwell but not yet tested positive for COVID-19, where will they be housed? And also, will all dorms eventually be gazetted as an isolation area, just to, because this operation sounds like a massive undertaking. And if not, then what are some of the assessment criteria as to whether to gazette a dorm as an isolation area?
So, first of all, we have looked at moving out workers who are not sick and who are doing essential work. And as I said, more than 5,000 have already moved out. Beyond that, we are also looking at moving out more workers, and the key criteria obviously will have to be those that are healthy, right? So as we step up our screening and testing of workers in the dorms, the key is to be able to separate those that are infected, the suspect cases, then you keep them separately, and then the healthy ones separate from the sick ones, right? So that is the key requirement that we have to be able to do dorm by dorm, which is happening. And to the extent that we continue to do that, and there are workers that are not sick, they are clearly healthy, then we can continue to move out so that within each dorm, the number of workers there are more manageable, and then the control measures that we have can be more easily executed. So that's on the first question. Second question was on the isolation designation. Actually, it's regardless. I mean, we have identified the 3 dorms and designated them as isolation areas. But regardless of the designation, we are basically, as Minister Josephine Teo talked about, a strategy of sustain, replicate, and scale. So we are going to do the same thing for all the dorms, all 43 dorms. Right? So we have started with the 3 as priority, but we are essentially going to scale the same strategies, the same measures across all 43 dorms. So whether or not they are designated, well, there is a medical definition. I mean, we will look at the specific indicators, but for all intents and purposes, in terms of the practical measures that will be rolled out and executed, really the designation doesn't matter because we will be doing it across all dorms anyway.
Let me just add that whatever measures we put in place in the gazetted dorms, similar measures will be put in place in other dorms, as Minister Lawrence Wong pointed out. So whether or not we will need to gazette more dorms will depend on the situation. And the earlier first few dorms that were gazetted, partly also because we need to move in very quickly so that the Director of Medical Services can specify the actions required under the Gazette very quickly. So this will give the DMS flexibility and speed that we need to respond to the situation. As we move forward, many of these measures have become standard measures that we have a template that we will replicate over the future dorms, and the need to gazette more dorms may not be so in time to come, and we will assess the situation as and when we need to introduce additional measures, and if we require the dorm to be gazetted as isolation areas in order for us to do so, and we will gazette them.
Yeah. Can I add a point to supplement what Minister Gan has said? In fact, even as we speak, we have brought together the dorm operators and started to brief them on what is expected, as well as to train them in how to implement the enhanced measures that were already implemented at S11, at Westlight, and at Toh Guan, and now being implemented in Sungai Tengah. So this heightened set of measures at the various dorms is, as was described by one of you, the journalists, that it is a massive undertaking. And in order to be able to do it well, we need to have the management structure, and that is what the FAST teams are for, working together with the dorm operators. We then need the standard operating procedures that can be used as templates, ported over to the different dormitories, and then further adapted to the ground conditions of the different dormitories, because they are not identical. Although the model of operation is similar, but they are not identical. So you will still need people to adapt them to the specific conditions of each of these dormitory. And then you've got to put them into practice, make sure that these new procedures stabilize, and when you can stabilize them, you can replicate them, and you replicate them, you can sustain them. So that is really important, a focus of the FAST teams working together with the dorm management.
Thank you, Ministers. We have time for the last 3 questions. Can we have Anshuman from Reuters?
Hi, Ministers. Thanks for giving this opportunity to hold a press conference. Are you able to hear me?
Yes, go ahead.
Great, thanks. I want to check, with the benefit of hindsight, is there anything that could have been done to avoid having to quarantine thousands of workers, just migrant workers in their dorms? And were there any other options considered apart from, besides quarantining the workers in the dorms? Thanks.
Well, the virus is moving so quickly that unfortunately we do not have the luxury of the benefit of hindsight. If I had known, of course, I would have done things differently, but no one can tell the next step, the next move. The reality is no one will know tomorrow if one case can very quickly spread into a cluster, right? This didn't happen before. Remember, Minister Josephine Teo said we had cases in foreign worker dormitories, but it never exploded into big clusters, right? It was the cases in foreign worker dormitories were in multiple dorms too, but we were able to pick them up, and there was never a cluster emerging. But this time it happened, right? So you deal with a very unpredictable situation where the virus spreads very quickly, and a single case, a single lapse by an individual who continues to work, continues to interact with very mild symptoms can easily end up spreading the virus to many, many people. That's our biggest concern, and that's why we repeat the same point. All of us, residents in Singapore, it doesn't matter nationality, your race, everyone who is a resident in Singapore has to take the circuit breaker and the safe distancing measures very seriously. Now that it has happened, what can we do? Well, to manage the foreign workers situation and the foreign worker dorm situation, then we have to deal, as I said, we put in all the resources we can muster, focus attention on this particular problem with a objective of containing the spread of the virus across the dorms, suppressing it as much as we can, and making sure that the workers' welfare is taken care of, their daily needs and their well-being and their safety. And that's why it is not just about saying, oh, we pull them out. You need to screen them, test them, separate the sick from those who are not sick, and then eventually have a proper system in place, whether it's in the dorms or the decanted sites, to manage all of the workers. And that's what we have been working on in the past few days. I must thank all the agencies who have been working 24/7 on this, particularly the Singapore Armed Forces and our police force, who have stepped up. Officials are on the ground, and they are now, like I said, across all the 43 dorms. So it is a very complex and massive undertaking, but we are fully focused on dealing with this issue at hand.
Just 2 points to add. Given the scale and the complexity of the operations, it was never going to be a trivial decision to implement these measures where the evidence did not previously suggest they were necessary. We couldn't have so easily said, well, let's do it, when there were no similar occurrences of the clusters that we see today. So it's not a button that you press easily, and it is a non-trivial decision to make, given the enormity of the task and how complex it is and how big, the level of resource mobilization that is needed. But I also want to add one more point that is very important. It is not as if we have not done anything to try and manage the situation at the dorms. Actually, the management of the dorms and the precautions that we were taking with regards to the population of foreign work pass holders in Singapore had begun all the way back in January, very early on. From 31st of January, we already implemented the requirement for all returning work pass holders, or to require returning work pass holders to serve initially a leave of absence, and then subsequent to that, we changed it to a stay-home notice. It started with the workers who were returning from the People's Republic of China, if you remember, because it was right after the New Year holidays, and progressively we extended it to all returning work pass holders, 14 days stay-home notice. Then from 7th of February, we even introduced entry approval requirement so as to regulate the flow of returning work pass holders. And these two measures that were implemented very early on, they were very strictly enforced. In that time, we made something like 90,000 inspection calls on all the people who were serving their stay-home notices or leave of absence. And as a result of that strict enforcement, we had about 90 persons whose work passes were revoked in order to signal the importance of the measures that we were taking. So those were one set of measures that were preventive in nature, precautionary, preemptive. We took them very early on. Now, specific to foreign workers who potentially living in dormitories, gathering, and so on. From the middle of March, we actually started to go to all the hotspots where they gathered and encourage them to break up large gatherings. And so if you went to Little India, you went to City Plaza, you went to Lucky Plaza, you would have seen over the course of 1 or 2 weekends, the crowds thin out by about 90% or even more in some places. Then within the dorms, from 24th January onwards, we started to engage the operators already, step up all of your measures. And then subsequent to that, we also reached out to the workers themselves, not just educating the dorm operators, but reaching out to the workers themselves, putting out a lot of information material in their native languages, translating content that would be helpful to the workers to take their own precautions. And then subsequent to that, went further, closing all the non-essential facilities within the dorm, such as gyms and TV rooms, and then staggering their meal times, staggering their recreation hours. So I want to emphasize that all of these measures had been taken, and that was probably how it was possible to have prevented clusters from emerging even before, earlier than what we are seeing today. So these are recent clusters, and in order to manage the situation, it's actually a very enormous task, and that's why we are mobilizing whole of government resources to get it done. If not for the fact that we are able to bring together the SAF, the SPF, working together with my colleagues in the MOM, and then getting all the other agencies to chip in, including the MND, helping to identify sites where we can relocate some of the workers to, it will not be so easy to carry out this plan.
Thank you, ministers. Can we have the penultimate question by Cassandra from Yahoo?
Hi, ministers. Can you hear me? Hello?
Yes.
Go ahead.
Yeah, hi. Given the focus on foreign dorms countrywide, what sort of impact will it have on major public projects in Singapore, and what are they, and what kind of delays can we expect? That's the first question. The second one would be, can we have some updates on the patient whose test results confirmed he was infected after his death? Any updates on his cause of death? Yeah, that's all. Thanks.
On the first question, really it's not just because of the infection clusters that projects will be delayed, because we have a circuit breaker in place. So with or without the infection clusters in the foreign worker dormitories, actually most activities have to stop, right? If you are not essential, including construction activities that are not essential. So that will already delay some construction projects, inevitably. Not because of the infection clusters, but as I say, because of the circuit breaker. And as I have explained, our strategy for the dormitories is to test aggressively, to separate out the healthy workers from those that are infected and those that are suspect cases, which is ongoing. We have already moved out one group, which are essential workers, and then we will move out more as we continue our testing. So once the workers are moved out, or once their workers are separated, either in their dorms, they are healthy but separated from the ones who are sick, or even moved out, once we have identified them, then they, beyond the circuit breaker, then they can continue to work. Right? So this is happening in the midst of the circuit breaker. No activities will happen anyway, but beyond the circuit breaker, with the testing, with the assurance that the workers are not sick, then they can resume work, and they will be doing so. And from that point of view, then projects will continue.
There was a question asked about a patient who had passed away, and subsequently a test had been found to be positive. I don't have all the details with me today. I would not be able, therefore, to give you a lot of details beyond what, in fact, has come out already in the press release. But the basic summary is that this particular person had presented to the hospital for a variety of different symptoms, and as part of the investigations and tests that were done, a swab test was also done for COVID-19. But because he was at that time quite well, and his symptoms were not assessed to be to the extent that he needed admission, he was actually sent home to rest at home while waiting the test results. And subsequently, he was found to have passed away very suddenly. And only after his death did his test results, in fact, get issued. It came out, and in fact, he was test positive. While this is continuing to investigated, the initial assessment so far has been that his passing away was not directly related to his COVID-19 infection, and he had, in fact, other medical problems that could have contributed to his cause of death.
Thank you, panelists. We will have the last question by Janarthanan from Tamil Murasu.
Right. Hi. My question is that relating to the recent death of the Indian national, any foreseeable issues as of yet with regards to sending the bodies of deceased foreigners back to their families, especially in the case of countries with more severe lockdown measures?
We don't have the details at the moment. I'm sure we'll be working with respective missions who are involved, and to see how we can make arrangements for a body to be returned to the country whenever that is possible. So we'll be working with them.